An eye exam consists of two numbers. The one number is for your distance, the other number is for your near. A whole lot of people spend most of their lives in between those two places. If you're on your phone a lot, if you are at a computer a lot, chances are the near prescription that you have is just too close for what you do in life. Today we're going to talk about designing intermediate and computer eyeglasses.
What are the limitations of a normal prescription for patients working at a computer?
So if you're like most people, chances are you don't have your computer 16 inches from your face. But the typical prescription, when you look at the add power component, that number is set for 16 inches or about 40 centimeters. Now, I have a whole lot of people in my life that are in the presbyopia phase of their life, and they got glasses and they got prescribed progressive lenses, and they hate them. And the reason they hate them is because the optician or whoever it was that prescribed the glasses took the prescription and just did it as is and said, okay, well, the progressive's cool. You got distance on the top, you got near on the bottom, and then you got all that power in between, so the patient will just adjust their head and find the sweet spot for them. Now, if you're using maybe 2 monitors or 3 monitors, a lot of people have multi-monitors, and you're trying to find this little corridor in the progressive that's your sweet spot to look through, your job's going to be pretty miserable. Now, they have different types of progressives designed for office use, and those are designed with that in mind. But they're also not really considering you as a human.
What should I be aware of when working with computer glasses?
So there's a couple things that you want to be aware of with your patient when you're working with computer glasses. So the first thing is, what is the actual working distance of the patient? How far away are they from their computer screen? And then you want to compensate the ad for that. The formula for that, super easy. So 16 inches is the refracted reading distance. Now, sometimes an optometrist will write in the script, oh, this ad is for computer use. But if they use that ad for computer use and they don't have a distance or a calibrated distance, you don't necessarily know how useful that is. So I had one patient I was working with where they were about 32 inches from their computer, and the doctor backed off the ad from a 250 to a 225, and that is just not enough. So I'll show you that with this formula. So what we're going to do is take 16 inches. So this is the refracted near distance. So 16 inches is the normal for that. So when you're looking at an ad, it might not be safe to assume it, but that's typically the distance that they prescribe for near. Now, the actual distance that they're working at is the number that we care about here, and for this person, it was 32 inches. So we take that ratio and multiply it times the add power. So if you had a 2 add power and you add 16 30-seconds, that's 1/2. So you go 1/2 times 2. So a computer ad for that patient would be a 1. Now, so if you have this patient, now you would put that in their distance part of their prescription and then the full power at the near. So basically what we would do, so let's say that your prescription was a plus 0.50 with a 2 add. You would do a plus 150 on the top, and you would do a plus 250 on the bottom, or a 1 add. So you would basically split the ad. You would put half of it in the top and then put the other half in the bottom. Now, the advantage of doing this is if you have a progressive with a lower ad power, everything gets easier from a wear perspective. So if somebody's wearing a 2 add, their corridor, everything about that lens is going to be much more compressed than with a one ad. So a one ad is going to have a much wider corridor, a much wider viewing area. So the other thing to consider is fitting height. So when we are walking about the world and we measure a seg height, we're measuring the seg height in a very specific way, in that we want somebody looking straight ahead. Now, if I'm a person, and this is, once again, best art, if I'm a person and my monitor is down here, I want to factor that gaze angle into my progressive lens. So you don't want to design it for here if they're looking down at an angle. So you're going to want to lower the fitting height so that it is aligned with their gaze angle at the computer angle. So if somebody's sitting lower than their computer versus at their computer, you would adjust the fitting height accordingly.
What types of lenses are available for computer glasses?
So there are a lot of different lenses available, and a lot of them are called office lenses or computer lenses and that sort of thing. But once again, oftentimes they don't necessarily factor in that working distance and that gaze angle. So unless I know exactly how that lens is designed, I would probably lean towards a lens that you know is more near focused and do the calculations manually and the seg height manually. Now, the difference between a near focused progressive and a distance focused progressive is your distance focused progressives optimize the distance wear and have as much clarity across the top as possible. Your near-focused progressives focus on a wider corridor and forego the distance a little bit. So this would be a near design. This would be a distance design. Many of the progressives have those kind of qualifiers on them. So you can just say, hey, like we primarily use IoT designs, and they have a balance lens, they have a distance lens, and they have a near lens. So we say, okay, we would like it to be the near lens, and that way the design is more optimized for corridor width, which gives you a wider field of view and would be a lot more comfortable for extended computer wear.